There's going to be a lot of terminology within this, so you are going to need to make sure that you stay on top of learning your terms. This is going to be very important moving forward, especially if you intend to do anatomy, sports med 2, any of those kind of things. What we're going to start out with is talking about the ways that injuries occur, and we're going to talk about the forces that can cause those so we understand how they can happen. So mechanical injury is the main way that trauma occurs. Now, we do define trauma as a physical injury or a wound. So think about rolling your ankle, cutting your hand, anything like that. It's either produced by an internal or an external force. So trauma is essentially the injury. Mechanical injuries result from force or mechanical injury that changes state of rest or uniform motion of matter. So think about this being more of something that's acting on us. So something that is changing a state of motion, usually of matter. Okay. Mechanical injury. You were moving, you cut, planted, twist. Mechanical injury because your uniform motion changed. Okay. Sorry, I'm not really sure how we jumped all the way to the end, so let's try that again. Okay. So there are several tissue properties. These are some of those terminology that you are going to need to go over. So here are the tissue properties. So tissue, think about your skin, your muscles, bones, all of those are types of tissues. Their load is the first term. So that is anything external acting on the body that causes internal reactions within our tissues. So think about lifting weights. You're literally moving an external force that is changing you internally. Muscles, pull on bones, soft tissue, all of that. That is a load. You could also think of it as pushing a sled, catching a ball, anything like that. Stiffness, that's the ability of a tissue to resist a load. Okay, greater stiffness is the greater magnitude of a load that you can resist. So in a sense, you want stiffness because you want the tissue to be able to resist the load. Stress would be an internal resistance to a load. So don't think about a mental stress. Think about an internal resistance to a load. So that muscle has an injury, it has a stress like it is an injury, therefore its stress is high because it's resisting wanting to use that load. Strain, internal change in the tissue. Usually this is length, and this usually results in deformation, or think about deformation means deform. So something bad happens, there's an injury, there's a deformity. So a strain, think about pulling something too far apart. So like muscles tearing, a strain because their length, that's what tears a muscle. It's almost like having a rubber band, pulling it too far, it pops. The rubber band is now deformed, and because it could not handle that length change, that strain. So within your tissues have an elasticity to them. They should be able to stretch to a certain extent. And then they also have, they have two different kinds of elasticity, viscous and elastic properties. Okay, so we put it together and say viscoelastic. But if we look at this picture, along the top part, we have a stress or load, and then we have the strain. So stiffness, remember, was your ability to withstand. So you're able to withstand the strain as it's coming, the stress. And then at some point, you're going to hit like a yield point. Okay. And this is the point at which your elastic properties, so your ability to mold, to stretch, to move, it's almost exceeded. Okay. You're almost to the point where you can't do anymore. If we keep going from there, you're going to get to tissue failure, which means an injury. Okay. So yield point is that point where your body's telling you like, hey, I should probably stop. This is getting intense. I don't think I can keep doing this. And we keep pushing past that. That can lead to tissue failure or injury. Now, some other of our terms. Tension, that's force that pulls and stretches you. Okay. Whereas shearing is more of a twisting action. Okay. So think about that. It's running in an opposite way. Forces can cause bending. Okay. And then if it's already bent, then there's going to be problems with like trying to load things on the top of it. Because think about if you have a pole and you push down from the top, it's going to go into the ground. If it's bent and you push down from the top, it usually is going to bend more. Torsion has to do with loads caused by twisting in opposite directions. Okay. Usually from the opposite ends. Usually this is perpendicular to the load. So that is more of a pushing. B is a pulling. And then C, you've got things moving in opposite directions, but they're parallel. So that's more of a shearing. Okay, so D is what I was talking about with your force pairs. Okay, so if you have all four, then you have the red ones. You've got two at each end, and that really doesn't cause the bending. It's when you only have these three green ones. You've got two coming in here and one from the middle, so it has no choice but to create a bending action. And then here it's showing you a few different examples. Shear is kind of going to go side to side. So like the top side's going left, the bottom side is going right. We've got tension, opposite directions, compressions, pushing down, several different forces that can act along the body. So as far as how susceptible we are to injury, our body mechanics can have a lot to do with this. This is why in athletics, we want to see how are you throwing the ball? How are you dribbling? How is your shot? How is your jumping? Because your mechanics can make you more susceptible to injury. Okay, so typically we're pretty effective if we're upright or standing up. Can usually get over forces. We use levers. Even if they're insufficient, we're usually okay. Now, we do have to overcome inertia, which muscle viscosity and being pulled in weird angles. So we do have to overcome that. But the main mechanical reasons that we see for injuries have to do with hereditary. So maybe it is a genetic aspect that's passed down. Congenital means you're born with it. So maybe it's an effect that you were, or an acquired defect. So maybe through injury, you acquired something through a sickness. Those things can predispose you to injury. So like you can't control them, but now you're more likely to have an injury. Okay, so congenital, imagine if you had a congenital heart defect, that's going to lead you to that. You can also have acquired heart problems or splenic problems. Those could predispose you. Now, the way your body is built can change things as well because there's different types of builds. There's ectomorphs, endomorphs, mesomorphs. Your actual structural makeup. Do you have a higher percentage of muscle than fat? What is your structure? And then habitual incorrect application of skill. So are you practicing all the time but you're doing it wrong? Are you building bad muscle memory? Are you building bad habits? We see this a lot with young athletes. That's why it's so important to teach proper technique no matter what the sport is from the bottom level up, because once you build a habit, it's extremely hard to change the habit. Microtrauma and overuse. So we see a lot of these kind of injuries with our athletes. Overuse means exactly what it sounds like. We are overusing a certain body part. We have done it too many times. Microtrauma, the micro tells us that it's tiny trauma. It is very, very small issues that we see happening in our muscles or in our tendons or even to our bones. So typically we see these injuries as a result of abnormal and repetitive stress. So a lot of times we will qualify these injuries as stress injuries, and stress fractures that we hear people talk about a whole lot. But think about if you're running a certain way all the time, you're always got that rhythmic, repetitive stress, especially if you're doing it incorrectly, though. Okay. Now, micro traumas can fall into a class with certain things that we can identify. Okay. So typically, this is going to have to pull you from sports. When we have these kind of injuries, we usually see pulled from sports. We see it a lot in running and jumping, throwing, softball, volleyball, baseball. Tons of overuse problems in shoulders. Our runners, track athletes, we see it a whole lot there. Some can seem extremely small. They can seem super, super minor, but they can end up taking athletes out for weeks and maybe even months, perhaps even whole seasons. So here are some examples of some of these overuse injuries. Achilles tendonitis, which I've shown you what happens when Achilles tendons rupture. Shin splints, huge overuse and micro trauma problem that we see in runners all the time. Shin splints usually come from a changing of surfaces, so going from running outside to a track to a field house to a gym, bad shoes, worn down shoes, could be biomechanics. Stress fractures, we see these all over the place. In every part of your body you can get a stress fracture. Osgood-Schlatter disease has to do with that bump that's just below your knee. Used to people describe it as growing pains, but it can be very debilitating. Usually people wear that strap around their knee if they have Osgood. Runners and jumpers knee are issues. Patellar chondromalacia, which is pain behind the kneecap. And then we can get apophyseal avulsions that can also be extremely painful while you're dealing with them. Now, there is a difference between a traumatic injury and an overuse injury. So remember, trauma is just any outside force acting on us that causes an inside result. So I like to think of traumas as accidents. Okay. So if you're going to do physical activity, whether it's as a sport or recreational, injuries are going to happen, especially over time. Okay. It's going to happen. So sometimes we use the term acute and chronic when we talk about these. So we usually consider an acute injury one that has just happened. It just started the injury process. You were running to the cafeteria to get lunch and you tripped and sprained your ankle. That sprain is an acute injury. You just did it. It's brand new. It's traumatic. Now, an injury, we tend to consider it chronic when it doesn't heal properly or it continually comes back. You'll get better for a little while and then all of a sudden it's back. We usually see this with tendonitis injuries. A lot of shoulder and elbow injuries are more chronic problems. Low back we see as chronic problems. So sometimes we can also talk about them as the mechanism. Traumatic means that usually there was a direct blow, a direct incident, versus overuse. We know that that's a repetitive thing. So acute and chronic, traumatic and overuse. We need to make sure that we understand how we are using those terms as we move forward with this unit. And then another way that we can try to ward off injuries before we even get going with them is by looking at a person's posture. I like doing this. There's not always time that permits it, but a lot of times if you stand somebody up, look at them compared right to left side, front to back, you can see abnormalities within their posture. And it can be an issue with muscle or bone or soft tissue. Maybe it's more developed on one side than the other. Well, the more developed side is more likely to get stronger, while the other underdeveloped side is more likely to be injured. It can show us poor pathomechanics, which is the way that you've been doing things forever, the way that things have developed within your body. But we can find those imbalances. So like I know when I've had postural analysis done, my right shoulder hangs lower than my left. And it's because of repeated chronic issues from softball and volleyball because I'm right-handed. So I have a lot of issues there. So I actually am slightly off balance as far as my shoulders go. That's pretty common. We see this too when people have been on crutches for a while or they've broken a bone. You're going to see an abnormality as they start trying to come back because they had to learn how to do stuff without that body part that was in a cast for so long that once they come back, they have new ways of doing things. And so the body adapts. So these can become chronic problems. They don't have to. If they do, a lot of times athletes have to stop participating. Okay. So, when possible, if we can look at your posture and correct problems before they even become problems, that is the ideal situation. So, if we can, the other thing is that when we do postural analysis, the way that you do it is that we hang like a string that has a weight on the bottom from the ceiling. So it just hangs straight down. You just put a small weight on the bottom, almost like what you would use if you were going fishing, just enough to hold it straight down. And then you have the person stand and you center that line like in the center of their body. And for some reason, activating that line there allows you to see a difference in right to left sides when we usually wouldn't see that. Once you look at them right to left, usually you would have the person turn and you line that line up down the middle of their body and you look front to back because even though things aren't exactly the same, they should be balanced. But that's how we do postural assessments. We call that line a plumb line. And then we'll go ahead and stop here and we'll start with muscle pathologies when I'm back on Wednesday.